Hello everyone. Today we are going to talk about the trigeminal neuralgia. So, trigeminal neuralgia is a neurological condition which involves the territory of the trigeminal nerve. So, as we all know, trigeminal nerve is supplied by it supplies the main of the face area, and it is of three regions that is called as ophthalmic zone, that is near the eye. As you can see, the territory which is supplied this part blue is all the ophthalmic area. Then is the maxillary area, that is above the lips and all this maxillary area, and the mandibular zone. So sorry, it is wrongly written here, it has maxillary zone. This is the mandibular zone here. So the lower one is the mandibular zone. So three zones are there. So suppose due to any reasons there is a hypersensitivity of the trigeminal nerve, the most common reason being explained as demyelination of that. So demyelination, if occurs or sensitivity of trigeminal nerve occurs or any compression occurs at this area, so there can be a symptoms that is like a neuropathy symptoms like tingling, numbness type of sensations which you can, or electric shock like sensations which can come over the face area, which is called as trigeminal neuralgia. It is more common in females when compared to males. So going to head by head, it is a facial pain syndrome. It is characterized by paroxysm. That is means that it's a very short lasting paroxysm, usually within 2 minutes, not more than never. The duration of this is more than 2 minutes, like shock, like sharp pain or stabbing type of pain, often triggered by activities like suppose you chew, you do brushing, or with light touch, this gets sensitive or gets triggered. So chewing, brushing teeth, or light touch can trigger it. Often, many a times, patient tells that on exposure to a cold air, patient get the symptoms. So this is triggers by this. It occurs basically because of the hypersensitivity of the trigeminal nerve. So females is more common, and usually onset of age is 53 to 57 years. The most common cause which is explained is the compression of the trigeminal nerve by the superior cerebellar artery. So superior cerebellar artery, it compresses the trigeminal nerve, and which is the most common cause seen in around 75% of cases. In around 20% of cases, it is basically because of the secondary causes, and the most commonly one is the multiple sclerosis. So multiple sclerosis involves the demyelination, that is the second most common cause for that, and in about 5 to 10% cases, it is actually idiopathic. There is no local cause was found. So secondary causes, multiple sclerosis increases 20 times chances. Tumors can also cause AV malformations and brainstem infarcts. So coming to the classification, this is of three types. One is the most common, that is a classical trigeminal neuralgia, which occurs because of the vascular compression by the superior cerebellar artery, which compresses the trigeminal nerve. Secondary is because of trauma, tumor, or multiple sclerosis. And third is idiopathic. There is no cause, which is 10%. So diagnosis, coming to diagnosis, it's usually a clinical diagnosis, and MRI we usually do basically to rule out the secondary causes. That means if you want to rule out the multiple sclerosis or a trauma or a tumor, if you want to rule out those cases, then only we do MRI brain. Otherwise, routinely MRI brain is not required. And this trigeminal neuralgia is usually a clinical diagnosis. So, international classification of headache disorders, which has given a diagnostic criteria, is that patient should have a recurrent. That means usually trigeminal neuralgia are not very single time. It usually comes recurrent and relapses are there, and it can either involve one or more than one trigeminal area. That means it can involve either ophthalmic, at least one should be involved, or it can involve more as well. Ophthalmic, maxillary, and mandibular. Usually it is short lasting, that is less than 2 minutes. It is sharp electric shock like pain, and usually precipitated by a stimulus like touch, cold air, and all these things can actually trigger that. So what are the differential diagnosis? Suppose a patient have a dental caries, patient have a temporomandibular joint dysfunction, migraine, glossopharyngeal neuralgia, post-herpetic neuralgia, temporal arteritis, all these things can actually resemble that of trigeminal neuralgia. So diagnosis wise and management wise, coming to management, usually it is medical management, and usually it may require for a chronic period of time or lifelong, because usually even after subsidence, this disease trigeminal neuralgia is recurrent or usually frequent relapses keep suffering. So most common drug, that is drug of choice, is carbamazepine, which is given at a dose of 200 mg daily. So you can divide this dose into like 100 mg BD, that is twice a day. Other drugs are oxcarbamazepine. You can also use gabapentin, that is neuropathic drugs, pregabalin, lamotrigine, and baclofen. Suppose the medical therapy is not successful, in few patients you can also try surgical options like microvascular decompression, because as we've already discussed, is basically because of the compression by the superior cerebellar artery. So to remove that compression, we can actually do a decompression, which is best for a classical type of trigeminal neuralgia, and patient usually stays symptom-free for around 3 to 11 years. Other ablative surgeries are radiosurgery, radiofrequency, ganglionosis, glyceryl injection, and balloon compression. The new drugs which are being tried are botulinum toxin, where we inject a botulinum injection at the site of the trigeminal nerve. And also IV lidocaine, lignocaine can be used, but it is still has to be proven, and it is very less evident. Coming to follow-up and prognosis, this is a chronic condition with remission and relapses. Many achieve either partial or complete relief. Secondary trigeminal neuralgia responds less well. So secondary trigeminal neuralgia, that means because of the multiple sclerosis or tumors, usually have less response to the therapy, whereas other responds quite well. So if you're interested, you can also I'll showing you the table which is showing the dosage and what is the duration, and it has to be given. Usually all these drugs has to be given typically for long term. Chronic management has to be given. Thank you.